Hi there, my name is Blaine. I'm a student physical therapist at South College. Can you please let me know your name and date of birth?
Candace Harris, September 22nd, 1979.
Thank you. So for today, I was just going to check your blood pressure and your pulse rate, check a couple other vitals. For this video, is it okay if we record you for educational purposes?
Yes.
Okay, perfect. So the first thing we're going to do is put on this blood pressure cuff. There you go. And now, does that feel comfortable?
Yes.
Okay. You can relax your arm. So the first thing I'm going to do is just check your pulse rate. So 36 times 2 is 72. So 72 was her heart rate, and next thing is going to be her blood pressure. But for the first thing I'm going to do is get her ablation. So I'm just going to palpate the radial artery. I'm going to pump this up until I feel that artery dissipate. Around 120 was where I felt it, so I'm just going to add 20 to 30 to that. So I'm going to be going up to about 140. And typically I would wait the minute after the ablation, but I'm just going to go ahead and go. So for the systolic, I got 124, and then for the diastolic, I got 76 was about where I found it at. So about normal, maybe a little bit hypertension because of the systolic over the 120, but that was it for the supine. So next thing we're gonna do is gonna go put you in the sitting position. Okay, I'm gonna let you go ahead and sit up. So my patient for this case scenario has a total knee arthroplasty on the right side. So as and it's the day of surgery, I'm just going to observe her movements and motions, make sure I'm telling some facial features to see if, she's wanting to pass out on me or anything. And right now she feels okay. I'm gonna go ahead and put on the gait belt for you. So she's able to hold herself upright, and I'm just gonna have her feet flat on a stool that I have her, and then typically we'd have a backrest as well. So I'm just going to redo everything again. I'm just going to check her pulse rate. And time it. And I got the same exact heart rate as last time, 72 heartbeats per minute. Next thing we're going to do is do the blood pressure. So for this one, I got actually underneath 120 for the systolic. I got 118 over 78, and that is in good range. So next thing we're going to do is going to stand her up and then take your blood pressure and your heart rate as well. For this one, I understand she has no shoes, but for educational, I'll make sure she has shoes on or non-slick socks. So we're going to stand up, and I'm going to be protecting that right side. I'm just going to make sure she's able to stand on her own. You can relax. I'm just observing, making sure she's able to hold herself and she's not going to give out, or if I see her getting flashes or paler, she looks okay. So for this one, I'm going to check heart rate again. Have you relax. So I got 40 this time, so 80 beats per minute, which is a little bit higher, but not too shocking. Just gonna fix your blood pressure just a little bit. There you go. Oh, it's around my neck. So the next thing we're gonna do is your blood pressure again. Yeah, it should be. I hope. Going up to the 140. So for this one, I got the same systolic pressure and actually an increase in the diastolic. I had 118 over 82. I'm gonna have you take a seat. So all vitals were in range and normal treatment vitals. Everything is good to go. Thank you for your time and thank you for the video.
All right, thank you.